Hi, my name is Bobby and I'll be the SRNA today. I will be performing a central line. This is Mr. Banana and he will be my patient today. I have reviewed his INR and platelets and I've checked if he has any contraindications, which he does not. I checked if consent was signed and it was. I also reviewed his allergies and he has no known allergies. I have placed a pulse ox on him and EKG leads, and I made sure that my alarms are audible. I'm going to go wash my hands, and now I'm going to grab my ultrasound. And it's a non-sterile technique at this point, so I'm just going to find and identify the vein and the arteries. Okay, so now that I've viewed it, I can see that the vein is compressible and non-pulsatile. So I'm going to angle the head to make sure that my artery is posterior to the vein. So now I have my mask on and eye protection and the hair covering. I'm just going to now clean off the Mr. Banana's neck, and I'm going to do it for 3 minutes. Clean, clean, clean. Okay, so now I'm going to make sure that dries. I'm going to place Mr. Banana in Trendelenburg, and that's 10 to 15 degrees. And I'm going to turn the head in lateral opposite so that I can see the internal jugular vein. So now I'm going to wear my gown, which is going to be in sterile. Here we go. And I'm going to wear my gloves. Difficulties, but let me get. Okay. Now that I have my gloves on, this is already has been opened. I'm going to get my sterile drape, and I'm going to place it appropriately on Mr. Banana's neck. Here we go. Now, I'm going to have someone hand me the sterile ultrasound probe with the ultrasound cover on it. I'm going to put it on Mr. Banana's neck, and I see it, and I'm going to just place it down in my sterile field since that is sterile. Next, I'm just going to grab I'm going to flush all my catheters, just assessing it. I'm going to do my white port, and then I'm going to thread my lumen through my distal port. So it's been flushed, and that's ready to use now. I'm going to now grab my my needle. I'm going to double check with my ultrasound at the jugular vein, and now I'm going to insert my needle at the ipsilateral nipple, and I'm going to make sure I'm going to access it, and I verify that there's blood return when I've accessed the needle. Now I'm just going to have blood drip, drip, drip. I'm going to next use my guide wire. I'm going to place it here. I'm going to thread my guide wire into it, and it's going to advance 10 to 15 centimeters. And I'm going to assess my EKG leads, make sure that there's no ectopy, which I have not. So now that my guide wire has advanced, I'm going to make sure that there are pictures taken so I can put it in the chart. And then I'm going to use my little scapula, just make a tiny little nick so that way I can use that for my dilator. So now I'm going to sure my guide wire stays on. I'm going to use my dilator now. Okay. Use my dilator. And now I'm going to advance the catheter through my guide wire. As well. And it's still sterile. When I get blood return, Mr. Banana, I'm going to make sure that I can push and pull method, and you take the guide wire out. I'm going to flush my catheter and make sure that I get blood return. And I get blood return. And then I'm going to check this other port, flush it again, and I see blood return in all of that one too. And next I'm going to suture it in, which I would suture. And then I'm going to apply a BioPatch dressing on it, and I'm going to place it on my banana. And that I'm going to document that I placed this central line, and I'm going to order a chest x-ray to ensure that it's proper placement. And I'm going to document that I placed this central line. Thank you.